Medicare Access and CHIP Reauthorization Act, the so-called MACRA, was signed into law by President Obama in 2015. It repealed the Sustainable Growth Rate, the so-called SGR, allowing for a different way to determine Medicare physician fee schedule. The core of MACRA is to modify physicians' Medicare payment schedule so that care delivery is focused on quality and on making patients healthier. The principle in MACRA is that physicians will be penalized if they don't demonstrate quality in care delivery, while rewarded if predefined quality metrics are met. Rewards and penalties will be effective in 2019 based on metrics reported for the year 2017. This quality payment program has two tracks that providers can choose from: Advanced Alternative Payment Models, APMs, or the Merit-Based Incentive Payment System, MIPS. Some critical points are worth noting regarding MACRA. Payments are related to patients' outcomes. Quality of care will always trump quantity of service. MACRA applies not only to physicians but also to nurse practitioners and physician assistants. In MIPS, a composite performance score is calculated based on 4 categories: quality, advancing care information, clinical practice improvement activities, and resource use. The weight of each of these changes every year. The resource use will be calculated based on the total cost that CMS assigns per capita for all Medicare beneficiaries attributed to a provider. Also, CMS is looking into publishing clinicians' performance scores on each of these 4 categories, as well as the overall composite performance score. This will be available on a Physician Compare website. MIPS penalties and bonuses are budget neutral in theory. For executives in hospitals and healthcare systems, understanding the implications of MACRA is critical because the viability of their business is interlinked with the success of physicians who work with and for them. Healthcare system executives should consider the following 4 areas as MACRA requirements go into effect: culture, strategy, patients, and physicians. When it comes to culture, hospitals and executives must always remember that MACRA represents fee for value versus fee for service. Hospital executives need to think strategically how to shift the culture in their own institution from volume to value. A culture that has spanned decades is poised to change within 1 to 2 years. When talking strategy, investing in IT infrastructure that enables proper reporting to meet MACRA requirements is an essential strategic initiative for executives and healthcare systems. Commercial contracts beyond CMS need to be assessed, looked at, and negotiated to be compatible with MACRA. When it comes to physicians, whether they are fully employed by a health system or simply linked to a hospital network, these physicians will look to their hospital partners for guidance and education on MACRA requirements, as well as resources and support with reporting systems and structure. Hospital executives need to assure that the administrative tasks associated with required reporting for MIPS and APMs do not result in their employed physicians having less time to provide the essential patient care. Executives are best to partner with their physicians to streamline the reporting processes. Financial relationships with physicians may need to be re-evaluated. When contracting with physicians, executives may want to tie the incentives to performance and delivering high-value care. When it comes to patients, executives have to ensure that the patient journey across the continuum of care is carefully evaluated and optimized. Communicating goals and objectives with physicians and other stakeholders within their institution is critical for success in this new environment. Also, with increased administrative MACRA tasks, assuring timely access for patients is key. As the composite performance score data will likely be made public through the Physician Compare website, consumers, patients, families are likely to get more involved in deciding who to supervise their care, especially as out-of-pocket expenses are likely to increase. The availability of provider-level performance data may influence hospitals' referral stream, reputation, and overall market share. Executives need to be ready as the reporting period starts in 2017. Regardless of how healthcare will continue to evolve, one thing is clear. Healthcare providers today need to find ways to deliver excellent care while taking costs and inefficiencies out of the system. To learn more how Cardinal Health has helped health systems tackle these challenges, visit us at cardinalhealth.com/healthsystems.